This meeting is now being recorded.
Hello, my name is Lana St. Clair. I'm a 2015 graduate of American Sentinel University, Doctor of Nursing Practice in Educational Leadership. Today I'm sharing my capstone project. My capstone project is titled The Impact of Simulation in Bedside Reporting on Patient Satisfaction Scores. I would like to thank my capstone chair and committee members for all their inspiration and support throughout this journey. For the introduction of this project, hospitals today are faced with a patient population of high acuity and with workforce issues that can result in a decrease in patient satisfaction. Improving communication and reporting methods have been shown to be an essential component for increasing patient satisfaction as well as decreasing the number of sentinel events. As consumer preferences continue to be a factor in healthcare, patient satisfaction will continue to be a priority in the strategic vision of healthcare organizations. With the adoption of value-based purchasing and pay for performance, it's important for hospitals to keep abreast of patient experiences not only from a safety aspect, but a financial standpoint. Some of the benefits of bedside reporting include patients' increased knowledge of their condition and treatment, improved patient and family satisfaction, and increased team building amongst staff. High-fidelity simulation is an effective strategy to teach bedside reporting skills. My problem statement is a decrease in patient satisfaction was identified as a problem in the organization, as evidenced by low HCAHPS scores. Throughout this presentation, HCAHPS scores refers to the Hospital Consumer Assessment of Healthcare Providers and Systems Survey that was developed by the Center for Medicare and Medicaid to measure patient satisfaction. The background of this project is based on the importance of effective bedside reporting in the transition of care from one nurse to another. The handoff of patient information during shift report between nurses is critical in providing effective communication and reducing the risk of medical errors. Historically, nurses have relayed patient information to the oncoming nurse through varied methods such as taped reports, verbal one-to-one report, and group reports. Research suggests that patient satisfaction is positively impacted by the implementation of bedside reporting. Bedside reporting has also been recognized as an effective tool in providing patient information during shift handoff by the Joint Commission through the development of the National Patient Safety Goals. Some of the barriers identified by nurses included fear of violating patient privacy, and the nurses just did not know how to perform the bedside report. This impacts nursing because communication between the nurse, patient, and family does make a difference in patient safety, quality of care, and patient satisfaction. The purpose of this project was to investigate the use of high-fidelity simulation as a method to increase patient satisfaction scores in a medical surgical unit in the hospital setting. The significance of this project stems from now we know that patient satisfaction can be an indicator of nursing quality care and does provide a link to patient outcomes. Hospitals are challenged to create a culture of safety that focuses on improving patient outcomes and reducing medical errors. Effective communication can mean the difference between good or bad patient outcomes. Literature supports the practice of bedside reporting as a means of providing quality care, patient satisfaction, and the patient-family participation in their plan of care. The innovative use of high-fidelity simulation training provides a strategy to improve handoff of patient information and can potentially improve the bedside nurse's skill and knowledge of an effective handoff and has the potential to improve patient outcomes. My project question was, is there a difference in patient satisfaction scores after nurses receive high-fidelity simulation training on bedside reporting? The theoretical framework for this project centers on the relationship-based care model. The model incorporates three crucial relationships, which are the relationship between the nurse, patient, and family, the caregiver's relationship with self, and the care provider's relationship with others. This model of delivering health care has transformed the practice of nursing by returning us to our basic purpose, caring and connecting with other human beings. The slide you see here illustrates the framework for the relationship-based care model, which is centered around the patient and family and illustrates a caring and healing environment that supports the fundamental dimensions of leadership, teamwork, professional nursing practice, care delivery, resources, and outcomes. Each of these elements in the model of care hold essential value of every individual's contribution to care, the pivotal impact of professional nursing care on patients' reactions to and satisfaction with nursing care. The use of this theoretical framework in this project provides a link to the importance of caring and patient satisfaction. For the literature review, I looked at three specific components: patient satisfaction, bedside reporting, and high-fidelity simulation. In regards to patient satisfaction, the literature review revealed that nurse-patient communication is essential to patients' perception of their overall care. Patient satisfaction is a quality indicator when looking at timeliness and patient-centered care that affects outcomes. Bedside reporting provides an innovative approach for the exchange of patient information between the nurse and the patient. Improved patient satisfaction scores directly relate to handoff communication. High-fidelity simulation provides an effective method to teach nurses bedside reporting skills and help nurses identify problems and inform solutions to improve the patient experience. For my project design, a descriptive quantitative design was used to compare patient satisfaction scores 3 consecutive months before medical surgical nurses received high-fidelity simulation and bedside reporting training, and also 3 months after the nurses received the training. This project had 2 sampling components: the nurse sample of medical surgical nurses that attended the bedside report training, and a sample of patient responses from the HCAHPS survey from eligible discharges over a 6-month period. This project takes place in an acute care 500-bed hospital, and the sampling data was collected from 1 medical surgical unit. The instrument used to collect the data was an HCAHPS survey developed by CMS in partnership with the Agency on Research in Healthcare Quality. The intervention in this project was the use of high-fidelity simulation. In the project, high-fidelity simulation was used to teach bedside reporting. 39 nurses from a medical surgical unit received the simulation and bedside report training. For this project, I developed a scenario for bedside reporting that was designed to incorporate the nurse-patient communication using the Situation Background Assessment and Recommendation, or SBAR technique, for handoff of patient information. The scenario was designed to focus on communication behaviors to enhance the realism of the handoff experience. Objectives for the simulated event included: the nurse will use the SBAR tool in giving and receiving shift handoff at the bedside. The nurse will practice the bedside reporting procedure using a scripted narrative that involves the outgoing nurse, oncoming nurse, and the patient. The scenario was designed to incorporate management of care, safety, therapeutic communication. Each nurse performed the outgoing shift report as well as repeated the process as the receiving nurse. Following the completion of the 10-minute simulation event, a 20-minute debriefing session occurred. A high-fidelity mannequin was used to mimic a post-op patient. A random sampling of patient responses from the HCAHPS survey were collected each month. The sample of patients are surveyed between 48 hours and 6 weeks after discharge. Patient satisfaction scores were collected for the months August, September, and October of 2014 that were identified as the pre-simulation and bedside reporting data, or Group 1. Nurses attended the simulation training in November and December of 2014. The post-simulation data were collected for the months January, February, and March of 2015 and again, data was collected at the end of each month. In this project, data was also collected for 3 quarters of FY14 and 3 quarters of FY15 to determine seasonality variance in patients' responses to the survey. The instrument used was the HCAHPS survey, which was used to measure patient perspectives on hospital care. It was developed in 2003 by CMS, and public reporting began in 2008. The HCAHPS survey consists of 32 items, with 18 of them addressing critical aspects of hospital experience, such as communication with nurses and doctors, responsiveness of the hospital staff, cleanliness and quietness of the hospital environment, pain management, communication about medicines, discharge information, and overall rating of the hospital. The HCAHPS is available in multiple languages in 3 different modes: mail, telephone, and mail with telephone follow-up. HealthStream was the vendor this hospital used to collect the data, and the survey questions were conducted via telephone interview. To test for validity and reliability, the CMS administered and analyzed surveys in many settings over a period of 5 years. They also constructed a large-scale experiment to test for potential bias related to mode, patient mix, or non-response. The internal consistency reliability for each of the 6 components in the survey has a Cronbach alpha of 0.80. Patient satisfaction scores are reported to the organization as top box scores. Hospitals focus on top box scores since those are used for value-based purchasing and public reporting. These scores reflect the organization's score and compares that score with hospitals of like size and services. A hospital's HCAHPS top box score reflects the percentage of respondents who gave the highest possible response on the survey scale. The survey includes 6 composite measures, each of which include 4 possible responses, such as always, usually, sometimes, and never. The response of always would be the top box score. For the overall rating of a hospital, the 1 through 10 rating, the top box responses are 9 and 10. The scope of this project was to measure the differences in patient satisfaction scores after using high-fidelity simulation in a hospital setting. The strengths identified in the project were evidence of the project supports the quality of care, patient satisfaction, and staff satisfaction. Patients' preference and recommendations of healthcare organization are key issues in the strategic planning for hospitals. The use of simulation does have the potential to improve communication and increase patient satisfaction. The limitations were related to small sample size from 1 medical surgical unit. We had a number of N equals 59. The data was collected monthly rather than the aggregated rollout data that is finalized for 4 quarters due to the time frame of this project. For the data collection and management, first, the project received approval from the American Sentinel University IRB, and then the Research Review Board from the organization. Demographic data from the nurse sample was obtained from the Human Resources Department, and all identifying information was extracted. The HCAHPS data was obtained from the Quality and Resource Management Department and was reviewed for score completion dates and checked for errors. The variables for use were top box scores, educational time, and weighted number of responses per month. All of these were established in a code book. The data was then entered into Excel and then exported into SPSS. For the protection of human rights, ethical considerations, confidentiality, and protection of privacy were addressed in the IRB submission process. The CMS HCAHPS Quality Assurance Guidelines monitor the performance of staff and subcontractors involved in the programming, sampling, processing of data, and handling of return surveys, data entry, and compliance with HIPAA regulations. The HCAHPS project team engages in a series of quality oversight activities, including inspection of the survey administration procedures, the statistical analysis of submitted data, and the site visits of the HCAHPS survey vendors. In this project, the HCAHPS data has been recorded and finalized and was not manipulated, but was only used to identify and compare scores at designated months used in this project. All data was kept in a locked file and had no patient or nurse identifiers. The dependent variable was patient satisfaction, and the independent variable was high-fidelity simulation and bedside reporting. Descriptive statistics were used to describe the demographics of the sample, which included frequencies, measures of central tendency, such as the mean, mode, median, and standard deviation. A Mann-Whitney test was used to compare and measure differences in patient satisfaction scores before nurses received the high-fidelity simulation and bedside reporting and after the training. The nurse sample consisted of 39 nurses from a med-surg unit who attended the simulation training. From the sample, 84% of the nurses were female, while 15.4% were male. Ages range from 20 to 63 years with a mean of 40.9 years. Races were divided into 4 categories for coding purposes: Black or African American, Asian, and white. 74% of the participants were white. The years in nursing were labeled in 5 categories. In this sample, 51% of them had 0 to 5 experience, and 10.3% of the respondents had 26 or more years of experience. The educational level or degree preparation was categorized as diploma, associate, bachelor's, master's, and doctoral degree. In this project, 25.6% of the nurses held an associate or diploma degree in nursing, and 51.3% had achieved a bachelor's degree in nursing. A Mann-Whitney test was used to measure and compare the differences between the 2 independent groups of patient satisfaction scores. This slide represents the data results. The pre-simulation group, or Group 1, sample size was 25. The post-simulation Group 2 sample size was 34. Total sample, 59. The top box mean percentile rank for Group 1 of patient responses to the HCAHPS survey were lower than those of Group 2, 21.0 and 36.62 respectively. This test indicated there was a significant difference in the top box mean rank. In addition, the results of the Mann-Whitney test revealed a top box median percentile score of 50.0 for Group 1 and 57.10 for Group 2. This represents a statistically significant difference between the 2 groups, with a p-value of a p less than 0.05, and actually the p-value was 0. Based on these outcomes, the null hypothesis was rejected. This slide represents a 6-month view of top box percentile scores from the HCAHPS survey. Group 1 indicates the pre-simulation patient SAT scores for the months August, September, and October of 2014. Group 2 indicates the post-simulation patient SAT scores for the months January, February, and March of 2015. In March of 2015, the overall patient satisfaction scores had risen to 73.3 as compared to the previous month. Inherently, an assumption may be made that the simulation and bedside reporting variable did have an influence on patient satisfaction scores. Seasonality was given consideration in this project. The plan included accumulative data from 3 quarters of patient satisfaction scores for FY14 and 3 quarters of patient SAT scores for FY15. Analyzing the results determined there was a significant correlation to seasonality on patient responses, and patient satisfaction scores dropped during the months from October to December each year. More than 9 in 10 people noticed seasonal changes of mood and behavior to some degree. Behavior changes related to winter depression could possibly influence the patient's responses in the survey. For the discussion of the results, now what does all this mean? The findings from this project revealed the medical surgical unit received higher patient satisfaction scores after the nurses attended the simulation and bedside report training. There was a significant increase in the patient SAT scores. What this means is that using simulation and bedside reporting in the hospital setting could impact key quality initiatives such as patient safety and patient satisfaction. Simulation and bedside reporting significantly contributed to the nursing unit's patient SAT scores. The null hypothesis was rejected. The relationship-based care model contributed to the significance of these findings. Assumptions may be made that nurses who receive the simulation and bedside reporting have the knowledge and skills to effectively conduct the bedside report and include the patient in their plan and care, which in turn did impact patient satisfaction scores. The significance of the results to the nursing profession is twofold. First, the findings from this project emphasize the importance of patient satisfaction to the patient, family, and staff, and the organization. Simulation and bedside reporting reassures the nurse works as a team to ensure patient safety, quality of care, and patient satisfaction. Second, the results imply that simulation and bedside reporting did impact both patient satisfaction and staff satisfaction and does promote a healthy professional nursing environment. Nursing leaders have an obligation to improve patient experiences and enhance quality of care for organizational reimbursement, for maintaining and exceeding accreditation standards, and upholding a reputation of quality services in the community. Leaders can apply the study findings in an effort to influence patient satisfaction in the healthcare organization. The theoretical concept of relationship-based care model, which is built on establishing relationships with the patient, family, and nurse, is clearly related to this project's outcome, which is an increase in patient SAT scores. Because taking the time to provide healthcare information and answer questions is another way to demonstrate caring, nurses have a potential to improve the patient's hospital experience. This project utilized the concepts in the caring approach to increase patient SAT scores. Based on the findings of this project, recommendations for leaders in healthcare organizations include the support of innovative methods such as the use of simulation for nurses and healthcare providers to learn new knowledge and skills that will enable nurses to make a difference in patient satisfaction scores. Consistent reinforcement of communication, education, and accountability of care is a must for healthcare organizations. A future study that included a larger sample could reveal a more statistically significant difference in the patient satisfaction. This project could be expanded to include all nursing units in the hospital and all hospitals within the system, which could have a more substantial impact on the organization's patient satisfaction. Replication is important to substantiate the results and determine generalization of the findings. Future work on research and education through simulation training in the hospital setting is needed to improve nursing competencies. There is limited research out there on simulation in the hospital setting, except for those hospitals that are school-based. Additionally, expansion of the project with a focus on nursing communication questions from the survey could add value to the significance in the use of bedside reporting for improving patient satisfaction scores. This survey used a telephone interview where patients' answers were recorded. An expansion of the project using a qualitative design to examine and compare the verbatim answers from patients could provide significant data based on patients' comments about their care. In summary, in answering the research question, is there a difference in patient satisfaction scores after nurses receive high-fidelity simulation and bedside reporting, this project found that patient SAT scores did improve after nurses received simulation and bedside reporting. Achieving higher patient satisfaction scores will continue to be one of the essential healthcare initiatives. Measuring, monitoring, and reporting scores will continue to be incorporated into the hospital quality of care metrics to increase nurse awareness, patient safety, and patient satisfaction. In general, patient satisfaction boils down to the patient, nurses, doctors, and staff. It's all about the people and how they're treated and cared for in the healthcare organization. Improving patient satisfaction requires a true commitment throughout the organization at all levels. Information learned from this project will provide organizations with the insight to support simulation and bedside reporting as a method to teach nurses new knowledge and skills. Results from this study contributes to the understanding of the importance of patient preferences, thereby supplying information to the leaders in the organization to diligently support a culture of change and improving patient satisfaction scores. This concludes this presentation. My references are listed. Thank you for viewing my capstone presentation.